On this episode, two medical mysteries that defied the experts. Adrian Martinez loves playing football more than anything. But that all changes when his leg begins growing in a way he could never have imagined.
But nobody really knew what was wrong with him.
I couldn't stand being alive anymore.
Wouldn't anyone help my son?
Then, when 2-year-old Haven Fowler begins to gain weight at a shocking rate, her parents find themselves in a desperate fight to save her life.
She had gone from 20 pounds to 43 pounds.
As a parent, it's heartbreaking. You feel completely helpless.
I thought, this is it. This is gonna be my last night with my daughter.
We look at the doctors for what they can't. If diagnosis is a mystery.
In the summer of 2005, Maricela Cruz was raising 4 children in the West Texas town of Socorro. With no man in the family, she felt especially close to her oldest boy, Adrian.
At that time, I wasn't working. I had a pretty hard life then.
But despite his family's hardships, for 12-year-old Adrian Martinez, it's a carefree time.
I had a lot of friends. They lived in my neighborhood. My favorite things to do was to ride my bike around.
Always active and energetic, Adrian appears to be in perfect health. Nothing seems out of the ordinary, except for his large birthmark.
It was the whole leg from hip to ankle. It didn't really bother him all that much.
The birthmark, it was a little pink. I didn't even notice my leg. Everything was good.
But one day that September, as Adrian is getting ready for school, he suddenly experiences a very strange sensation. His right leg is extremely hot.
I could feel the heat waves coming out of my leg.
The heat was pretty intense. I think I could compare it to an iron. And that's when I took him to the pediatrician. They just said that he would grow out of it.
But over the next 4 months, the bizarre feeling only intensifies.
I noticed my leg getting hot all the time. I just thought it was like a freakish thing that was happening to me.
And it's not long before Adrian notices something even more disturbing.
I was playing football with my friends, and I felt a heaviness in my leg, and it was getting real hard to walk. I noticed that my right leg was a little bit bigger. I was just didn't know what to blame it on.
Hoping for the best, Adrian tries to ignore the change in his leg. But over the next month, it seems to grow even larger.
I noticed that his leg was getting wider and bigger as he was going through puberty. I really didn't know why it was getting so big.
It was about 20% bigger, and it was swollen up all the time. I couldn't ride my bike anymore because my leg was rubbing against the frame of the bike.
His leg was actually growing so fast. I just knew something was terribly wrong with my son.
Alarmed, Maricela brings Adrian into the local clinic.
His pediatrician really didn't have any knowledge of this problem. He just recommended that I just leave it alone. I was not satisfied with that response, so I decided to ask a couple other doctors.
She takes Adrian from appointment to appointment, but no one can explain why his leg keeps growing.
The doctors would just run tests, and they never really told me what they were looking for. And then they would say there was nothing wrong with him, that they couldn't find anything.
At this point, I was seeing the doctor at least once a month. My right leg was about 35–40% bigger. I was getting really frustrated and mad at the doctors because I thought that they should know everything and that they should know what was happening to me.
But nobody really knew what was wrong with him. I just wanted some answers. Wouldn't anyone help my son? The leg just kept getting bigger and bigger.
In 8th grade, I was getting depressed about the size of my leg. I realized that people were looking at me. They were laughing.
It was something that, nobody has ever seen. He could not hide this problem at all. Even if he wore baggy pants, it was very noticeable.
It was getting real hard to walk. And after a while, my ankle started hurting. I feel like a sharp pain, like someone was hitting me with a hammer.
Frightened by his painful new symptoms, Maricela takes him to the hospital.
They did all kinds of studies to see if they can find something wrong with his leg.
They're doing x-rays to see what was around inside my leg. They're checking the radius around my leg. They're doing MRIs and CAT scans, and I was worried that I had cancer or a disease that could kill me in 6 months.
My biggest fears about the doctors running these tests were for them to tell me he might pass away.
Over the next 3 weeks, Adrian and his mother wait anxiously. And finally, the results are in.
The doctors told me that I had elephantiasis.
Elephantiasis is an extremely rare disorder of the lymphatic system, which causes tissue in the lower half of the body to dramatically thicken and swell. The condition is not well understood, and there is no known effective treatment.
I was shocked. They told me that there was nothing that could be done, that we had to wait till he got older and see what would develop from there.
I was just wishing for it to just stop growing. It made me feel kind of sad that would never happen.
Horrified, Adrian returns home and tries to manage his condition the best he can. But his leg continues growing. By his sophomore year, it's 2.5 feet in diameter and weighs 100 pounds.
I could barely even walk from class to class.
Adrian would have to leave like 10 minutes earlier to get from one side of the school to the next.
When they let me out of class early, I wasn't walking fast enough, so when I was going up the stairs, I got caught between everybody that was trying to go up and down the stairs.
Somehow, Adrian gets through the school year, but the leg persistently balloons up.
When I was a junior, my leg was about 3 times bigger than my left leg. It was about 56 inches around. Yeah, I was scared. I just didn't know what was happening to me.
If diagnosis is a mystery.
Over the past 3.5 years, 15-year-old Adrian Martinez has watched in horror as his right leg has grown in a way no one could have ever imagined. By his junior year, it's a grotesque 56 inches around and weighs nearly 150 pounds. Just when he thinks it can't get any worse, a shocking new symptom begins to emerge.
I started getting little pimples on the right side of my leg. They were full of white pus.
When the pimples would pop, it had a very foul smell to it. I took Adrian to the dermatologist. He didn't say what was wrong with the skin. He mentioned that this was the biggest leg he has ever seen. He actually didn't know why the leg is bigger than the other. The dermatologist told Adrian to do his best to keep his leg clean just by showering.
At a dead end, Adrian watches the disturbing pimples multiply, while his days in school turn into a nightmare.
I felt really scared all the time. if they would pop in the middle of class. And whenever I smelled it, I just thought that everybody else was smelling, they'll just stare at me. So I couldn't stand being alive anymore.
Then, just when Adrian feels like he's hit rock bottom, a teacher at his school takes him under his wing.
The first time I met Adrian, I made it a point to find out more about him and talk to him about what he was going through. He was a bit frustrated in regards to that the doctors really didn't know what to do, what it was. I realized that not only was Adrian really, really special, but he really needed a lot of help. We live in a community where there's not a lot of resources. I wanted to try to get him to a specialist, and maybe there's some type of medication, maybe some type of therapy that will help him have a normal leg. Adrian and I started searching the internet.
It felt really good that a person that was first a stranger would be like one of my best friends.
As we started to research this elephantiasis, we realized that some of the symptoms didn't quite match up with everything that he was going through.
Sure, he's onto something. Luis redoubles his efforts, and 2 weeks into his search, he comes across a disease that seems to match Adrian's symptoms to a T.
I talked to some of the experts about Adrian's condition, and they were able to point us in the right direction to get the best help available for Adrian.
2 weeks later, Dr. Robert Rosen, a New York endovascular surgeon, agrees to look at Adrian's file.
What stood out to me when I reviewed this patient's history was the degree of enlargement of this limb. In the years that I've been practicing, I've seen a handful of patients that had this degree of involvement of one extremity. After reviewing Adrian's medical records, it was clear to me that Adrian was suffering from Klippel-Trenaunay syndrome, or KTS.
Klippel-Trenaunay syndrome, or KTS, is a rare congenital abnormality that generally involves one arm or leg. In a healthy individual, a complex system of arteries, veins, and lymph channels develop in a fetus to carry blood and lymph fluid throughout the body. But in patients like Adrian, for some unknown reason, these vessels fail to form properly. As a result, two things happen. First, deoxygenated blood or lymph fluid collect in the affected limb, causing swelling. Then, tissue overgrowth and skin abnormalities may develop, resulting in deformity.
KTS, which stands for Klippel-Trenaunay syndrome, is a malformation of the blood vessels and abnormality of the lymphatic system. And it usually involves one limb, usually a leg, during the course of blood and lymphatic vessel development, which is a very complex process. In the embryo and the fetus, all of these primitive vascular spaces that are there at the beginning, which normally refine themselves into arteries and capillaries and veins, somehow get disordered. They're called cavernous venous malformations. They grow with the individual. And there are some situations where hormonal changes can cause the malformation to become much more active, typically at puberty. The tissue overgrowth is not completely understood. Part of it is either blood or tissue fluid accumulating in the limb, just making it larger. And then there also tends to be an actual overgrowth of the tissues in the extremity.
I realized just how serious this was. As we researched more and found out more about it, we came to the painful realization it could be a great danger.
I was really scared I would probably die.
If diagnosis is a mystery.
16-year-old Adrian Martinez has just learned that he has KTS, a rare disorder which has caused his leg to grow horrifyingly large. But to Adrian's shock, his birthmark, which no one thought important, was in fact the first sign of the disease.
Classically, KTS involves kind of a reddish-purple birthmark. The reason these birthmarks are sometimes warm to the touch is that the blood is obviously warm. Most likely, as he grew, the blood flow became higher to the surface of the skin, and the closer the blood is flowing to the surface, the warmer it will feel to the touch.
Even more surprising, Dr. Rosen suspects that Adrian's right leg was always bigger. But it wasn't noticeable until puberty sped everything up.
In the average case of KT syndrome, the abnormal tissues in the leg will grow along with the rest of the body. These are fairly subtle at birth and may become more apparent as the child grows. And generally, when growth stops in late adolescence, early adulthood, the malformation will stop growing.
And while Adrian struggled to live with the incredible transformation, the next symptom to surface, the pimples on his leg, added to his distress.
Fluid pressure in the tissues is so great that it just infiltrates out to the skin surface, forms these little blister-like areas. Undoubtedly, the tissue fluid in his case was probably infected, and probably why he had recurrent inflammation. As in any infection, an odor can develop related to that. The most serious aspect of these soft tissue infections is that they can spread very rapidly, and they can cause instability of the blood pressure, and can be life-threatening.
I'm really glad that, they were able to tell me in time.
But her relief turns to fear when she learns that nothing can be done to prevent a life-threatening infection.
The lymphatic malformation, when it's abnormal, there's no direct way to correct it. It's such a tiny network of small, almost microscopic vessels that you can't reconstruct them or rebuild them in any way. This patient's history was really the extreme end of the spectrum of KT syndrome. It's extremely rare to have this degree of limb enlargement.
The doctor said that the last thing I could do to have a chance of living a longer life was to get my leg amputated. I felt like the wind just knocked out of me.
The risks were very high on the surgery. They told me that he has a 50% chance of dying on the operating table because he had so many veins, and that in the process of the operation that he might bleed to death.
I was really scared that after everything that I went through, that I would just die all of a sudden on the table. My mom, she told me that ultimately it was my choice. I decided to do the operation.
I think that he has a real strong character because it's so hard to make this kind of decision, especially at a young age.
A lot of conservative measures had been tried, and it was just unmanageable. Living with this on a day-to-day basis can be less traumatic to live without the limb than to have a limb that's endlessly causing problems.
In October 2009, Adrian is wheeled into surgery at a local hospital.
The last thing I said to my mom before they took me into surgery was I told her not to worry about anything, and I told her that I love her.
I told them that I loved them and that everything would be okay. A whole lot of things were going through my mind. Especially, that I would never get to see him alive again. His surgery took 12 hours. When the doctors came out and told me that his surgery was over and done with and that he had came out very good, there was just a sense of relief. I was kind of concerned. I thought, that Adrian was going to have a hard time adapting to having only one leg. He was worried that, he would never be able to get around, that it was going to be worse than him having that leg.
If diagnosis is a mystery.
Over the last 5 years, Adrian Martinez has suffered from a painful, disfiguring disease that left his leg weighing a shocking 150 pounds. Now, he's undergone an amputation and is faced with the extraordinary challenge of making a new life for himself.
I didn't really know what to think. I didn't know if I was gonna be happy or sad. When I looked down at my leg, I just felt like the whole world was just lifted from my shoulders. I felt lighter, and I felt happy about the choice that I made.
Still, Adrian can't help but wonder why so many other doctors fail to identify the disease.
From his records, they estimated that the leg itself weighed up to 150 pounds. Over the past 30 years in my practice, I've seen only a handful of patients with this severity of KTS, and I've probably seen upwards of 1,200 or 1,500 patients with the syndrome.
Today, Adrian is 17 years old and about to enter his senior year of high school.
This last semester I had straight A's. I hang out with my friends a lot more often than I used to.
Since the amputation, Adrian is more social. He feels more comfortable. It's like whatever problem there was is no longer there, and now it's open to just being Adrian.
For now, he gets around school in a wheelchair and uses crutches at home. But he's looking forward to using a prosthetic leg one day.
I got a prosthetic leg, but the muscle in my stump is not strong enough as it would be if I had more bone. I have to go to therapy to learn how to walk with my prosthetic.
My hopes for Adrian's future is that he gets up on that leg and he's able to walk on it with no problems. He can get into college and, get a good career.
I know that Adrian is going to have a great future. He is such a special kid, such a special, special soul.
I want to tell Mr. Bettis, thank you for helping me out, even though he didn't really know me, and for being there for me as my friend. If it's possible for me to have a better life, today I feel really good.
Here's this kid that went ahead, accepted his condition, made a decision, and now he is moving on with his life.
While Adrian Martinez was tormented by an undeniable deformity. Next, Misty and Chris Fowler find themselves in a desperate search for a doctor who can explain why their little girl is gaining weight at an alarming rate and experiencing horrifying hallucinations. In the fall of 1999, 24-year-old Misty Fowler was excited about starting a new job with an internet company in Maryland when she was introduced to the man of her dreams.
Chris and I met at work. He was a web designer. I was an assistant to the president.
Her boss said, "This is Misty, and she's small, but she's mighty." We just had a connection. It was very natural and kind of quick.
We dated for 2 years before we got engaged.
We both really enjoy the outdoors and spontaneous nature of heading in a direction and kind of seeing where that takes us.
After tying the knot in 2001, Chris and Misty settle into married life. And one morning, 2 years later, Misty has some thrilling news.
I just looked at Chris and I said, "We're pregnant." And we were just kind of screaming and we were completely overjoyed.
That initial feeling that we were actually finally having a child together was pretty exciting.
On January 26, 2004, Misty and Chris welcomed their daughter, Haven Christina, into the world.
I felt completely overwhelmed when I first saw her come out. You think you're kind of ready, and then complete overwhelming rush of emotions. It's a pretty magical moment.
They brought her over to me and I don't think I let go of her for at least 3 or 4 hours.
Completely overjoyed, the young parents take their newborn home 2 days later and begin their life together as a family.
Haven was a very happy baby and perfectly healthy. She was hitting all of her developmental milestones on time, if not early.
Haven never had a flu or a cold or sniffles or any of the typical sicknesses. She was the picture of health.
In Haven's first 2 years of life, she was very spunky and loved to dress up, would wear plastic high heels and her little boas and run around the house like she was a fashion model.
Then, one day when Haven is 2.5, Chris and Misty are leafing through a photo album when they notice something odd.
Haven was always on the skinny side, and comparing the pictures, we noticed there was certainly something changing pretty quickly.
Haven seemed to be gaining some weight. We hadn't changed anything in her diet, and it seemed strange to me, so I decided I should take her to the doctor. He put her up on the scale and weighed her, and she had gone from 20 pounds the previous month to 43 pounds now. I was shocked. Her pediatrician felt that this could be a thyroid problem causing her hormones to fluctuate and ultimately cause her to gain weight, and he told us that he would like to run some blood tests and go from there. I wanted something to be there because then I could fix it. 3 days later, I received a phone call from her pediatrician, and all of her blood tests were fine. The doctor told us that we must be feeding her too much and needed to cut back on her food.
But to the Fowlers' surprise, after 3 months of dieting, Haven is still gaining weight.
It seemed like every 3 to 4 weeks I had to buy her almost a new wardrobe, and I didn't know what was wrong.
Unnerved by Haven's bizarre transformation, Misty schedules another appointment with the pediatrician.
He put her up on the scale, and she had gained another 15 pounds. I was very frustrated. The doctor now felt that it was a high possibility that Haven could have a tumor in the pituitary region of her brain.
The pituitary gland helps to maintain metabolism. If it malfunctions, patients may gain weight rapidly.
Hearing something like a brain tumor from your doctor is completely terrifying. You know, your job in life is to protect your child, and that's the last thing any parent wants to hear.
Over the last 4 months, Misty and Chris Fowler have watched their once healthy daughter mysteriously triple in size. She's gained almost 40 pounds despite a highly controlled diet. Now, her pediatrician believes that a brain tumor may be triggering the rapid weight gain.
Hearing that she could have a brain tumor was horrifying. It just changes your world in a 30-minute meeting with a doctor.
Terrified, the Fowlers race Haven to the hospital, where she undergoes an MRI to confirm the doctor's hunch. The next 3 days are almost unbearable as they wait anxiously for the results.
Finally, we received a phone call, and he told us that there was nothing. They found nothing. Everything looks great. There was no tumor. There was nothing out of place. There was nothing wrong.
To hear that the MRI was negative was a complete relief, and at the same time was very frustrating.
There was something definitely not right. But the doctor came back and said that we're not watching her diet close enough, that this is a parental issue and not a medical issue. And we just felt alone.
Discouraged, the Fowlers do the best they can to monitor Haven's diet even more closely. Then, when they least expect it, a terrifying incident sends the family reeling.
I heard a scream from upstairs, and I ran upstairs to see what was going on. And Haven was sitting up in the bed, and her eyes were open. She was kind of glassed over. She looked like she was still sleeping, but she was shaking. I tried to calm her down, and she whispered into my ear that there was a little girl in her bed. I told her there was nothing there, and she just had this look of terror in her face. And she told me, "No, Mom, there is a little girl in my bed, and she's bleeding, and she's smiling at me."
For a 3-year-old to say something like that, it's just like ice through your veins. That was much, much more than a nightmare of even the worst kind. So I think we were as scared as her at that point.
Overwhelmed, Misty calls the pediatrician, but he assures her that there's no cause for alarm.
He told me at age 3, this is a very normal thing, and that she would grow out of it.
But she would wake up kind of every night or maybe every other night and kind of have like a night panic attack where she would think she sees something, and she started getting worse and more animated. She'd get out of bed, and I'd find her standing up, even though she was still seemingly asleep. One morning, I went in to go check on Haven, and she was not in her bedroom at all, and of course, this immediate panic, and I went kind of quickly checking through the house.
We found her on the couch sleeping, and next to her were 5 banana peels, 6 puddings, and 5 apple cores. We couldn't believe that she'd actually was able to eat this amount of food. But when we woke her up, she had absolutely no recollection of eating it.
Knowing that if she's eating in her sleep, everything kind of fell into place, and that was the cause of the constant weight gain. But the fact that she was actually taking things out of the fridge and eating, all while still in some kind of a dream state, was pretty terrifying. So we started coming up with our own ways to deal with her nightly behavior.
It came to a point where we had to put a bungee cord around the refrigerator so that she couldn't get into the refrigerator and eat in her sleep. Eventually, I slept next to her on the floor, and I tied a ribbon from my wrist to her wrist so that if she did get up, she couldn't go far without me knowing and feeling the tug on my wrist.
We would be taking turns kind of staying up on watch.
It was very hard on both of us. We hadn't been sleeping now for 5 months. We were starting to argue more because we were both exhausted.
But 2 months later, something horrifying happens that turns their world upside down.
I heard Haven snoring, and I've never heard Haven snoring before. So I walked into her room and could see her body's stiff and her back is arched, and she actually had foam over her mouth.
I heard Misty scream, and I ran upstairs and found Haven. I rolled her over, and her face was tense and clearly in distress. She wasn't sleeping. It was something completely different. I thought it was some sort of seizure. My first thought was to clear her mouth and clear her airway, but her jaw was locked tight, and I could not get her mouth open.
All of a sudden, I could see that she had actually stopped breathing. Instantly, I thought, this is it. She's gonna die. This is gonna be my last night with my daughter.
If diagnosis is a mystery.
Over the last 8 months, 3-year-old Haven Fowler has exhibited a bizarre constellation of symptoms. She's gained almost 40 pounds, experiences horrifying hallucinations every night, and has even started to eat in her sleep. While none of her doctors are concerned, the Fowlers are sure something is very wrong, especially when Haven goes into a seizure and suddenly stops breathing.
I was on the phone with 911, and Chris started CPR. We were going crazy. Chris stayed in the house with her, and I actually ran outside screaming for any of the neighbors to help. And then the ambulance and the fire trucks arrived. At that point was when I actually felt the relief because somebody was coming to get her.
Once the paramedics resuscitate Haven, they're shocked at how high her blood pressure is.
I just told him that we needed to fix her, that we couldn't let her just go, that we had to get to fix her.
They rush Haven to the hospital, where a team of specialists is waiting for her, including pediatric endocrinologist Dr. David Cook.
When she was admitted, the evaluation mostly was directed at making sure she didn't have an underlying seizure disorder. But what struck me most was her obesity, and her blood pressure was pretty strikingly above normal.
Dr. Cook suspects that Haven has a pheochromocytoma, a tumor that forms near the kidneys which causes high blood pressure. To confirm his hunch, he orders a CT scan.
I was extremely hopeful that we would finally have an answer to what was going on with Haven.
But when Dr. Cook reviews the scan, he sees something thoroughly unexpected.
We were dealing with a completely different type of tumor. Haven had what appeared to be a neuroblastoma.
A neuroblastoma is a tumor of the adrenal glands or nervous system. It tends to spread quickly to other parts of the body.
The neuroblastoma is a type of cancer that children can die from and needs to be treated very aggressively. So the next step is to remove the tumor.
I was in shock.
As a parent, it's heartbreaking. You feel completely helpless.
2 weeks later, Haven is prepared for the operation.
They allowed me to walk to the table with her, and she actually was giving me some strength because she was so willing and so ready to do this. And she helped the anesthesiologist with her mask, and I gave her a kiss on the forehead and tried to retain my composure.
For 14 hours, Chris and I sat there in the waiting room. Finally, the surgeon came out and told us that Haven had done great during surgery. Everything went as planned, and we were discharged and sent home for Haven to recover.
The Fowlers are hopeful that Haven's problems are behind them. But as the weeks go by, nothing changes. Haven is still gaining weight and sleepwalking.
We were disappointed because we really hadn't changed anything. It was all still there. We called Dr. Cook and told him that all of the symptoms were still there and progressing, and he promised us that he would continue to search for a diagnosis for Haven.
Now that we've removed this tumor, but the symptoms haven't gone away, we're still left with a very complicated patient. So we took a step back and reevaluating all of the symptoms and findings that we had on Haven, and through some research into the medical literature, we discovered a very rare syndrome that could actually describe all of these features that Haven had. And so we were able to conclude that Haven has this syndrome called ROHAD.
ROHAD, or rapid onset obesity, with hypothalamic dysfunction, hypoventilation, and autonomic dysregulation, is an extremely rare disease which impairs brain function. Ordinarily, when a tumor develops, the immune system defends the body by attacking the growth. But in patients like Haven, for some unknown reason, this protective process goes haywire. Experts suspect Haven's immune system targeted the tumor, but then went after her brain.
The cause of ROHAD syndrome is unknown, and in fact, most physicians have not heard of ROHAD syndrome.
Now that we had a diagnosis, we knew what the name was, but it was again another shock of how do we have a disease that no one knows about.
If diagnosis is a mystery.
Misty and Chris Fowler have just received shocking news. Their 3-year-old daughter, Haven, is suffering from a rare and dangerous disease called ROHAD. The condition attacks several parts of the brain, including the hypothalamus.
The hypothalamus is a part of the brain that controls a number of body functions, including our appetite control center. So injury would lead to excessive eating and rapid onset of obesity. And we think that this ROHAD process is injuring the parts of the brain that we're controlling, our sleep pattern. This damage to the brain would explain the night terrors that she demonstrated.
While it's unclear what triggered the seizure that Haven experienced, Dr. Cook believes that, in time, the disease started to affect more and more parts of Haven's body, including her autonomic nervous system.
The autonomic nervous system is the part of the nervous system that controls things like our blood pressure. So with autonomic dysfunction, the patient isn't able to keep those parameters where they should be.
As the Fowlers process all the information, they're faced with a grim reality. Without a solid diagnosis, eventually the disease would have affected Haven's ability to even breathe.
In a syndrome like Roe had, the part of the brain that tells us to breathe isn't working, and so early on it might just cause you to breathe slower than normally, but eventually it could cause you to actually stop breathing.
To hear it from doctors that your child could just stop breathing was almost impossible to comprehend.
There is no cure for ROHAD, and because we don't know what the underlying cause of ROHAD is, there is no standard treatment.
To hear after all of that, well, there is no treatment for this, the ground just kind of falls away and you're just completely lost at that point.
While ROHAD has been identified, medical experts still don't understand the exact science behind the disease. As a result, patients are treated on a trial and error basis.
Based on the theory that ROHAD syndrome in Haven was caused by an autoimmune process, it was decided to treat her with chemotherapy to suppress her immune system to try and turn off this autoimmune process.
To have to go through chemotherapy without the knowledge that this is a proven solution was a very hard thing to do.
We were hopeful that her symptoms would regress and we would gain the old Haven from age 2.
After receiving this course of chemotherapy, Haven showed a number of improvements. Her blood pressure was back down to normal. In addition, her weight appeared to stabilize. We don't know whether those improvements are temporary or whether they're permanent. We're cautiously optimistic that they're going to be long-lasting, but we will have to watch her over time.
And while they are thrilled with Haven's recovery, Misty and Chris can't help but wonder why no other doctor was able to put the pieces of the puzzle together.
ROHAD is very difficult to diagnose because it's so rare. There's only been about 50 cases ever described in the whole world's literature. In addition, the features of ROHAD syndrome are all seemingly unrelated, making it even more difficult to put them together into a single diagnosis.
Today, Haven is back to loving life and head over heels about her new puppy.
I have a dog named Daisy, and she's a schnauzer. She barks at people, but she's a good snuggler.
She's off of chemotherapy, and her condition seems to be in remission.
We maintain a very strict diet still. Her weight is continually an issue, but at this point, if that's as bad as it's going to get, we'll be more than happy to deal with that.
Haven is in first grade now, full-time, and not missing a beat.
I'm happy that I'm at school because my friends are there. My favorite subject in school is art class. And when I grow up, I want to be a teacher.
I just hope for her a happy life, not limited by anything. And finding this diagnosis, I think she's got every opportunity to make whatever dreams she has a reality.